Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
Welcome back. We begin our first conversation of the day with a panel of three persons who are representing the Ministry of Tourism and, of course, the Benque Viejo border. We have with us this morning the Chief Executive Officer in the Ministry of Tourism and Diaspora Relations, Nicole Solano. Good morning, CEO.
Good morning, Isani. Good morning, Marlene.
We also have with us the Chief Tourism Officer, Abel Castaneda. Good morning, Abel.
Good morning, Isani and Marlene.
And finally, we have with us Javier Gutierrez. He's the site manager at the Benque border. Good morning, Javier.
Good morning, Isani. Good morning, Marlene.
All right, so the opening of the land borders is quite an interesting situation because there are concerns abound with respect to how we're going to go about doing this in the most effective way. Perhaps we can begin with the CEO to give us an explanation as to how we arrived at agreeing upon the reopening of the border in the days ahead. Kindly begin for us, CEO.
Thanks, Isani. Yes, I want to begin by saying that the borders are not closed. The borders have been open since last year. And today we're really excited to be able to be adding in another layer and another element of arrivals, and that would be for tourists only. That's a decision that we've been trying to come to for many months. The airport has been open since October, and we've been looking at the possibility of opening the land borders, since December, January, all the way through. We've been talking about opening seaports. We've been talking about revising and reviewing and evolving what is happening at the airport. So the conversation of opening ports is not one that just started, it's one that's been on the way. So we're excited as a team to be at the point today where we can add for tourists. As you know, the free zone has been open, and there's a lot of activity, especially in the northern border. And today we're able to welcome tourists again. So we're really excited and happy about that.
So
Let's talk a bit, because being able to understand why this move is necessary, it's also to put into perspective the flow of tourism that would come from land borders. And that would include through Benque, through the northern border, and also those who come in from boats and head out maybe directly to the islands.
Exactly.
So what's the typical flow? What do we expect?
Okay, so border management handles the 4 border points: the western border in Benque, the northern border in Santa Elena, in San Pedro as well, and in Punta Gorda. The San Pedro and the Punta Gorda borders are seaports, no? They're not land borders as the north and the west, as you know. So what we've decided to do is to open first the land borders, and then depending on how that works, we move to the next level of opening. We now call it, there are 3 phases of opening. So you have phase 1, phase 2, phase 3. In phase 1, we have 1A, which would be the land borders, and 1B, the San Pedro and the Punta Gorda. So we're focusing first on Benque and Santa Elena.
when this decision was being made, I gather that you guys were in close consultation with the Ministry of Health. Were there any concerns that were raised in respect of how we're going to go about doing this? And what perhaps were some of those concerns?
Yes, the conversation with health in particular, but also with immigration, customs, Baja. In the case of San Pedro and Punta Gorda, the Port Authority, there's been ongoing conversation and ongoing back and forth as to what would be the best way to do this and the safest way to do it, because obviously the safety in travel is our priority. So the conversation has been ongoing. We've been discussing this, as I said, not only for those 4 border points, but also for seaports. We're having a conversation about cruise tourism returning, and there's ongoing discussion. We had early in the year a tourism recovery task force where this discussion began. We have a cruise tourism task force. So all of this is ongoing. The Ministry of Health has a significant amount of requirements that we have included in the protocols and the standard operating procedures in order to make this work safely. Obviously, we're in a pandemic, and the advice of the Ministry of Health would be the main information that we consider. So things like ensuring that the travelers have a negative test to enter the country is one of the first requirements.
Yeah.
Ensuring that travelers have a reservation at a gold standard hotel is another requirement. And they also have to be transported by gold standard tour operators. And these are all stringent measures that are based on protocols that are in place currently at the Philip Wilson International Airport.
Yeah, sorry, if I could just, because I don't want us to get too much into what will take place at the border. I still want to understand or help bring some clarity to the why and how the decision was made. Clearly, we are aware that the medical community specifically have pointed out many concerns about the reopening of the land borders, specifically because of the situation of COVID in Quintana Roo as well as Petén. But before we get to that, explain to me how the decision is made. It's not the Ministry of Tourism that makes this decision. And how do you, who did you make the recommendation to? And what did you have to account for to allow for it to get approved?
So from a Ministry of Tourism standpoint, we have to look at the economic recovery of the situation. And I know that a little bit later in the conversation, we'll get into details like numbers, statistics. Yeah. Bill has all of that in order to share precisely what and the whys, the amount of revenues we're expecting and all of that. Yeah. It's a decision, or it was a recommendation made by the Ministry of Tourism based on the fact that we need to move toward economic recovery. And we have been doing that with the increases in arrivals at the airport, and adding the element of travel through the land borders is very important for us to get to that place where we need to get in terms of tourism recovery. Tourism recovery, of course, is the same as, or a very important role to play in economic recovery. Mm-hmm. So how do we get to that point? We look at what we need to do, and we make a recommendation to cabinet by way of a cabinet paper that all ministries do that. Ministries make recommendations or requests to cabinet based on what is needed. So we do that based on discussions that have taken place with all of our partners. Immigration in particular was a very important one, and health. When that recommendation was made, in fact, we've been looking at cabinet papers for several months. Mm-hmm. It doesn't get automatically approved. There's always a concern. There's always a return. Let's see what we can do differently. What do we need to do? And it got to the point middle of May where the decision was agreed to, and it was accepted that this is the way that we need to move forward. So no, the ministry does not make that decision. The ministry implements the decision that is made at the cabinet level. Our minister, of course, represents in cabinet, and as the Minister of Tourism, he would make the recommendation, and based on that approval, we implement. So that's where we're at this point.
Yeah. And so, as you noted, a part of being able to get the approval was to ensure that protocols could be put in place at the borders itself to ensure safety. I know Javier is with us. He's at the Benque border. He can talk to us a bit about the preparation process that you guys have been through so far.
Yes, Marlene, the preparation has been quite intense. The Ministry of Tourism has ensured that the safety of Belize, will be there. And I can assure Belize that it will be. For instance, the Ministry of Health is leading this venture. What we have done at the border is whenever somebody comes in, the first people they will meet is going to be a screening process done by the Ministry of Health. Mm-hmm. The Ministry of Health will determine whether that person is good enough to enter Belize or not. What do I mean by that? If you have a PCR test, a negative PCR test, 72 hours prior to coming into Belize, you will be allowed to come in, of course, following other protocols like using your face mask and 6 feet separation and other things like this. If somebody is positive with COVID, the Ministry of Health will decide, you cannot enter Belize. We also have the Customs Department, the Immigration Department also very prepared. They have all the knowledge of what to do. Another very big requirement is a gold standard hotel and a gold standard transport operation that will have to pick you up. You will have to have proof of the solid documents of this as well before you are accepted to pass through that border into Belize. It's going to be very tight. It's not going to be very easy for anybody to just come in. We will also have the Belizeans that will come in from abroad. And if a Belizean comes in, and if in case, let me go on the negative side first, if in case that Belizean there would be positive, then of course the Ministry of Health will kick in. They will be isolated, and when they're isolated, then of course they will have to be transported to a gold standard provider for quarantine. So it's not going to be quite an easy process for anybody entering the nation. We're going to be there. The Border Management Agency will lead this venture. We're going to be there all the time. And of course, the Ministry of Health is going to be doing that very intense screening. And of course, Customs and Immigration are going to be there in full support. So that, and Baha is going to be there, and the police present at the border all the time to ensure that this process is done diligently.
All right, Javier, so that's for the land borders. Explain to us how it will work now if persons are coming to Belize, let's say from Livingston, Guatemala. They're going to come over by boat, and say, for instance, someone is positive for COVID. Do we just turn the vessel back with them on board? How does that part work?
That's a very good question. But at the same time, I'll throw this to the CEO. I'm going to give her that respect. I'm in Bengueville, El Carmen. I can tell you about us. I can tell you about all the borders. But I'm very certain that we do have plans for this if this would happen.
Can you expand if there's anything on it, CEO?
Yes, Isani. As I mentioned earlier, we're focusing in the first instance on the north and the west. So all of our standard operating procedures have been focused on those two border points. We are not at the point yet where we have elaborated the standard operating procedures for San Pedro and Punta Gorda. Those will come next. Our focus is on these two border points, which is why the others are not open yet, and we haven't announced a date yet for those two.
Looking at the protocols that are expected at the land border, they're very similar to what we see at the PGIA. The difference, though, would be that, especially for air travel, there are some checks that are being done beforehand with the airlines themselves. We don't have that luxury at land borders if people are coming even through public transportation or private transportation. How do you ensure that when people arrive at the border, it doesn't become just doesn't become a black eye situation where someone has to figure out what they'll do because they test positive?
You want me to take that?
Yes, go ahead.
Okay, so indeed, there are differences between the international airport and the land borders. Currently, we have a lot more traffic coming in at the PGIA than we will have at either of the land borders. So there's more social distancing, there are actually more stringent protocols in place at the land borders compared to the international airport. For example, currently, if you are a vaccinated traveler and you have had your full vaccination and you're coming in through the international airport, you do not require a test. At the land borders, every single arriving passenger requires a negative test to enter. Also, the window for the test is narrower at the land borders. So at the international airport, you need a test within 96 hours, whereas at the land border, it needs to be within 72 if it's a PCR. If it is a rapid antigen test, at the international airport, it will be accepted within 48 hours of arrival, whereas at the land borders, it needs to be within 24 hours of arrival. So the Ministry of Health has insisted on more stringent measures at the land borders simply because we can implement those a little bit differently than we can at the airport. Now, you're asking what happens if there is a positive case, and that is something that we're looking at. Currently, we have said that if there is a positive case arriving, or if somebody tests positive on arrival at either land border, that they would not be allowed entry. But we also know that the reality of that situation is, what if it's late? You know, we're looking at all of the situations. So the SI has actually made allowances for the situation where a traveler can be put into quarantine on arrival. So we have a backup plan for that, but the intention is to suggest that they cannot enter if they test positive. And then we have a backup plan if that doesn't work.
Okay, before we move further, can you give me some insight as to how many tourists who have entered, foreign visitors who have entered the country, have tested positive upon arrival? How often does it happen?
It's a very low number, Marlene. It's almost immaterial compared to the number of passengers that we have coming in. I don't know that we have exactly those numbers, but when I was asking that question to Health the other day, I think we were talking about a couple of people test positive on arrival per week, and some of them aren't even tourists, some of them are Belizeans. Most of our tourists come in with negative tests already, or they're vaccinated. Many of the people that are being tested at the airport are Belizean travelers. And currently, if a Belizean tests positive at the airport, they're asked to go to their home to quarantine. In the case of tourists, they need to be quarantined in a specific approved quarantine hotel or a gold standard hotel. So I want to emphasize the fact that for tourists in particular, all of the protocols are more stringent, because we're trying to, the tourism industry in no way wants to see lockdowns. We want to see the relaxation of measures, and we want to see things open up. So I have noticed that the tourism industry in particular has been very careful about protocols. The private sector has done that. You may have seen some exceptions to that where some situations don't work exactly as they should, but for the most part, the tourism situation is very much under control. And throughout Belize, I mean, even with our local numbers, everything has been kept low thanks to the good work of the Ministry of Health and all of our citizens who have been responsible in addressing this. The vaccination is going to be an important component, and for the tourism industry, we have emphasized the importance of the industry becoming vaccinated.
Let's get Abil in on the conversation at this point. What does this mean for the tourism industry from your perspective as the CTO, Abil?
Good morning, Isani. I think a question Marlene had asked earlier about what's the significance of the traffic that goes through the borders, and I think it's very important to highlight. Pre-COVID, the borders were bringing in about 23% of our arrivals, international arrivals. Out of that 23%, about 60 to 65% of those arrivals primarily were from European countries. Mm-hmm. And these European travelers are your budget travelers, are your travelers that visit destinations like Ikaker, and they're the ones who bring businesses to the small, the micro and the medium enterprises in our industry. And so they are a very important part of the economy, mm-hmm. Where it relates to tourism. And I think we cannot highlight that more. In fact, that was one of the principal reasons why, from a tourism point of view, the request for the reopening of borders was made. From a more macro point, when we look at what's happening around us, from a tourism and economic point of view, the last report from the World Tourism Organization mentioned that over 70% of the countries worldwide have reopened their borders at minimum to travel and trade. Mm-hmm. And what that means is that many of our competitors around us have also been open for quite some time. Now, in tourism, we are all looking at, how fast can we recover? And one of the things that we are looking at is that this year in 2021, the threshold for recovery for globally is that countries should reach around 40 to 50% of the pre-COVID arrival numbers as a part of the recovery process. What we have seen is that some countries are well on their way to that, but other countries, are falling behind. In regards to Belize, I see you just cut to the PGIA. Mm-hmm. We are seeing some very optimistic numbers there, but PGIA by itself will not get us to the threshold where we can see that Belize's tourism industry is healthy, back on the road to recovery. We need that element, that segment of our travel that comes to the land borders, because as I mentioned, the European traffic principally would use those as a means to visit not only Belize but the other parts of the region.
Sorry, Abel, if you could just update us there. You said some countries are on their way to the target and some countries have fallen short. Where does Belize rank? What percentage are we in terms of what is expected?
Well, we are anywhere between 20 to 25% back. So we're actually seeing our numbers being very positive for the summer, for travel, and even more so for the winter season that's coming, especially with the addition of airlift. So we are on our way, but when we run our projections, without the land borders, we will fall short about 10 to 16% of being at least around the 40 to 50% recovery rate. And so what that means is that tourism is like any other business. It's really a competition. It's a realm of competitiveness. And so if we want to regain the level of competitiveness that we had pre-COVID, which was at an all-time high, we need to ensure that we are at least giving us the chance to do so. Yeah. So that's from a strategic point where we're coming from, and hopefully that brings some clarity to why we're looking at the border reopening at this time.
All right, so what we'll do at this point, we'll take a quick commercial break, and when we return, we will continue our conversation on the opening of the land borders. Stay tuned.
Dwayne Moody, Isani Cayetano, Andrea Polanco, Paul Lopez. Your News 5 Belize teams do whatever it takes, go wherever they need to go, so you can catch the story wherever you are, whenever you want, on whatever device. Channel 5 Belize on television, Facebook, Instagram, and YouTube. Because news is now everywhere, all the time. And so are we.
And we're back, and if you're just tuning in, we are continuing with a conversation talking about the protocols for the phased reopening of land borders. We're joined at this time by the CEO in the Ministry of Tourism and Diaspora Relations, Nicole Solano. We have with us Abel Castaneda, who is the Chief Tourism Officer, and Javier Gutierrez, who is the Site Manager at the Benque border. Now, before we went to the break, Abel, you were breaking down those numbers to explain to us the impact that these borders have on travel into the country, especially for European travelers. We've been told many times before they would spend 2 weeks and move around Central America or Latin America and do so by using the borders. Now, let's dive into the details of how these measures are going to be implemented. I know you were getting into it briefly, CEO, so maybe we can start with you, and then Javier tells us a bit more of the details.
Marlene, so let's talk about the northern border first.
Yes.
Actually, I was informed that we already have one couple, I think it is, at the northern border waiting for opening, which is good news.
Wow.
Yes, we were informed that we also had somebody yesterday, I think, and they asked them to return today. But basically, what will happen is they will come overland, however it is that they arrive. For example, if they're flying in from Mexico City, and they fly from Mexico City, say, to Chetumal, and they get a taxi from Chetumal Airport to the northern border, they would need to have their reservation. Let us use a real example, because I was told that one of them had a booking at Ramon's, right, in San Pedro. So the person would need to prove that they have a reservation at Ramon's. So they get dropped at the border and they first pass through the health checkpoint. So health will check to make sure that they have their negative tests. If they have that, they can move on to immigration, who will check to make sure that they have their reservation. And once they have what they need to enter the country, they can pass through. There's a pre-screening area at the northern border. So once they meet those criteria, they pass through to what you might recognize as the usual place where Customs and Immigration checks the passports. When they get in there, they pass from there, and then they would then need to get into a gold standard approved transportation, whether it is a taxi or a tour operator, and they would then be transferred, for example, to the airstrip in Corozal, for example. And Tropic Air or Maya, they're both gold standard, would then transfer them over to San Pedro, after which they would be picked up by their hotel and stay in their gold standard hotel. So that's an example of the flow. I know you might want more details in terms of the SOPs at the actual border point, and Javier can go into that.
Go ahead, Javier.
Yeah, definitely. I'll just follow the same pattern CEO used. They are allowed to enter the gates of Belize at the western border, and it's going to be the very same at the northern border. We're going to have two people from medical department. These people will ask all the necessary questions to the foreign traveler about COVID, and if they have their PCR test 72 hours prior. If they don't, then of course they're sent to the waiting area where then the Ministry of Health will apply. They will give testing there too. If they're found negative, then immediately they will be taken into the building. At this moment, all of this is happening outside the building, the customs building. They will be escorted into the building. From this point exactly, they will be taken to the inside of the border building, where then the immigration department will meet them. Immigration will then ask them for the documentation for their stay. Their stay has to be a gold standard hotel or a resort. When all that is finished, they're passed over to the customs department that is very protected too. These people are protected with all the necessary prevention from the separation between guests and immigration, custom, Baja, etc. We have that protection for them. When customs gives them the okay, the search is done, they are taken then outside the building. Now, outside the building, the Border Management Agency staff will be waiting for them. If their transportation has been accepted to come in, then of course, our staff up at the border building will go through the checking of that vehicle again. What do I mean? Is that they will have to have decals. The BTB will give the gold standard operators decals to prove that they're gold standard. If they show that, then of course that means that they're one step there. We will open the van and make sure that we have all the necessary cleanliness and all the other qualities that the gold standard transport has to have. And then, we will give the okay. The guests are put in and then taken out of the property. Mm-hmm. There is no other vehicles that are going to be accepted at the border point area or inside the area if they're not gold standard, apart from the staff that work at the border. So the border is going to be properly protected. One other thing that I must mention, the Belize Border Management staff is 100% vaccinated, and that was not mandatory. I must say that. Our staff was not mandatory. We did not force them to do that. It all came through patience and education. Mm-hmm. And it was their choice to do that, but we're lucky because, people want to work and they want to keep safe as well. We all want to keep Belize safe.
How does it work for buses that are going to be coming over the border?
There, at this point, we are not accepting any vehicle from outside to come into Belize up to this point. Mm-hmm. Whenever the tourism industry or whenever the ministry, along with health, decides that we can get to that next phase, then that will be done. For right now, the guests are going to be walking through the gates of the border. We have a gate that separates the border for quite a distance. Yeah. We have a walkway that leads these people onto the border point where the checkpoint will be by health. And of course, we have also placed all our floor decals and 6 feet separation. We have also put signs on the walls that, to remind people to keep 6 feet apart, to keep washing their hands, and as well to wear their masks. We are also going to have our staff spraying people's hands. We're going to be having an automatic sanitizer at the entrance and at the outlet of the border points, arrival and departure, where you're going to be putting your hand, the sanitizer will come out, and that instrument will also test your temperature immediately. Okay, so everything is modern, it's going to be automatic, and like I said, we have all put the emphasis on the safety of Belize.
So no buses, but
I prayed for COVID, but I am certain that we will be safe.
But so you said no buses, but what about those vans, especially at the Benque border? We know that sometimes travel agencies or travel companies have small vans. They're like private transportation that bring people across the border. Are those included?
No, Marlene. People are going to be walking through.
So they literally have to have transportation arranged to pick them up on the Belize side of the border. Approved.
Gold standard transportation. They'll be there waiting on their people when they come in.
Okay.
Can I comment here,
Yes.
Marlene? I just want to say that we know that it will take some time, similarly to the airlines. It will take some time for the buses to start to come back. It doesn't happen immediately. They have been waiting patiently for the announcement that the Belize borders would open so they can start the plan and start to put those excursions together. Remember, we're in very close communication as well with the private sector. The Hotel Association in particular has been very instrumental in helping us to understand the flow of those travelers to their hotels. We are made to understand that it will take some time before those buses begin to have regular runs. So it's not going to happen immediately. It will give us that chance to test the protocols and as I have been saying, these protocols will evolve over time the same way that they did at the international airport. So what you will see on day one is not necessarily what you will see, a month from now. We will have to adjust as we go, and depending on the situations that we face, we make those changes, no?
Yeah. And looking at the, as was outlined, it is only foreign visitors. So if there's a Belizean who lives in Guatemala or Mexico who wants to visit, or if there's a Guatemalan or Mexican who wants to visit and stay at a home, they're not allowed to do so.
Yeah.
Well, I want to remind as well that Belizeans have been coming in across the borders. Yes. So any Belizean that comes in, I think that they ask that you get special permission from immigration for departures, for special situations like medical and other. Yeah. Belizeans who come to the border can come in. They cannot be turned away. They do have to meet those requirements of testing, etc., and they can come in and stay with family and friends. In the first phase, tourists cannot. Tourists cannot stay with family and friends. Tourists have to be booked at a gold standard hotel, but it could be any nationality. Okay. So it could be someone who is coming in for recreational purposes, who is booked at a gold standard hotel and moves with a gold standard tour operator. It doesn't matter. In fact, we welcome our tourists from Mexico, and we welcome our tourists from Guatemala as well, whether they're residents or other nationalities living in those countries. Yeah. That is fine,
But that's also one of the areas of concern when we look at the COVID numbers, especially just across the border. Abel, put it into perspective for me. How many of these travelers who come through land borders are actually from the neighboring countries? Isabel still with us?
Yes, hello,
Okay.
Good morning.
Yes.
Yeah, sorry. I can get those numbers. I don't have it on me right now. What I can say is that, for instance, already we have traffic coming in from these countries. The PGIA, for instance, receives daily flights from Guatemala City, from Cancun, and so we already have some true flow of traffic in that regard. But also, one of the things that we are looking at is that how can we ensure that the populace from across the border maintain the same level of responsibility in their travel over to Belize. And so what we're doing is that we're mobilizing a campaign of information sharing with the communities on the border areas in both the Guatemalan side and on the Mexican side. for them also to understand that it is not a true sort of free-for-all opening of the borders at this point, that there are significant restrictions that they must abide by. And so we believe that if we do so, we can also deter any particular citizen from those countries that may not be willing to uphold the different requirements or regulations that we have.
So what you're saying, sorry, just to get some additional clarity, what you're saying is that we do have flights coming in from Guatemala at the moment, and we do have flights coming in from Mexico.
Correct. We have Tropic Air flying in from Cancun.
Yes.
We have TAG Airlines from Guatemala that comes in from Guatemala City on a daily basis. And these flights bring in anywhere between, the Tropic Air would bring in around 12 persons per flight. And the one from Guatemala can bring up to 50 persons per flight. And so, we have had those with us for quite some time now, and those have been a part of the general population of travelers coming into the country for quite some time. And also, as CEO had mentioned, we haven't really seen any sort of spike or mass instances of positive cases at the airport. I also want to mention a very important aspect too, that when we reopen not tourism, but when the country reopened the Corozal-free zone, we also put the systems that were put into place were very similar to what we are looking at right now. And currently, our understanding at the free zone, for instance, is receiving 600 to 700 vehicles per day of Mexicans from Quintana Roo and different states coming into the free zone. And at this point, because of the strict measures that are there also has not been any instances of infection and all of that. So I think we have to look at it from that point of view and understand that the system that is put into place is going to be our best, one of two of the best bets in terms of ensuring that our populace remains safe. The second one would be vaccination. I saw the last figures that we're still around 20-25% vaccination in Belize, and from the tourism sector, we from the beginning have been encouraging our workers to consider taking that vaccination, because it allows us to also have that ease of mind that we are also protected. So those are some of the elements that I think we have to consider. But as we have been saying, the borders really have not been closed. We are now adding this additional element, but we are very happy to say that the systems that are put into place, as has been described, are even more stringent or even more strict. And so I think we would be in a good place. And at the end of the day, we stand guided by our colleagues at the Public Health Department.
Bill, you brought up a very important point, and I wanted to bring that question over to the CEO, talking about the vaccination uptake for the tourism industry. Where are we now, and what are the efforts to be able, whatever number it is, if it's not 100%, it's a weakness for the industry. We've seen where in other parts of the Caribbean, the leaders have gone beyond just asking people to volunteer. They're also talking of being able to tell people that if they don't get vaccinated, they'll ask to work from home, or perhaps won't be able to get employment. Where are we in Belize?
Well, I'm sure you recall, Marlene, that we had lobbied for 8,000 vaccines in the beginning to be allocated to the tourism industry. I am informed that close to 70% of those have already been taken up by people in the tourism industry. That doesn't mean you have other people who work on the front line who may have come in under other categories when the Ministry of Health was open only in categories. But we know that we are anywhere between, I think it's something like 65 to 70% of our allocation, those people have gotten at least their first dose. So it's a high percentage for the industry. And lately we've seen additional people understand that they have to become vaccinated, but not only for the industry itself. We are interested in making sure that the communities and the destinations also get vaccinated, because that's the only way to assure work. It's the only way, and people realize that, they're beginning to realize that. Even some of the people who didn't want or were skeptical in the beginning, they realize that in order to work, they need safely, and to be safe, they need to be able to access the vaccine and protect themselves, no, and their families. So I think I think there is resistance. There's resistance all around, but more and more I'm seeing specifically within the tourism industry where people are realizing I don't want to have to test every time I go to handle a cruise passenger. In fact, in the cruise industry, they are requiring or they are requesting that their tour operators in the destinations are vaccinated. Harvest Key has informed us that only vaccinated vendors will be allowed on the island. So people realize the importance of it. They know that if they want to work and if they want to be safe, they need to get vaccinated.
Can we segue, now that you've mentioned the issue of cruise tourism? I know that on Friday, the Minister of Tourism spoke on the schedule for the return of cruise ships to Belize. Can you expand on that in terms of the discussion that you have been having with the Florida Caribbean Cruise Association and what that's been like?
Yes, we've been in constant communication with FCCA and the lines over the past few months. Of course, bringing cruise or the return of cruise is important to a lot of our small operators. And we're monitoring what is happening at CDC. There was a movement for cruise lines to operate over out-of-home ports in the Caribbean. That might be changing as CDC continues to evolve and to change their conditional seal orders. We're seeing changes almost on a daily basis where the options are opening. So Norwegian Cruise Lines had indicated initially that they would be coming back in August. With the changes in cruise departing out of the US, some of those the scheduling might change. So we're waiting for confirmation of exactly what the schedules would be, but Carnival as well has indicated return of ships July, August. So we are looking forward to that. And in order to be ready, we have to make sure that all of our tour operators, tour guides, destinations, attractions, even the archaeological sites, that we are prepared and that we implement those gold standards in order to receive the ship. So that is our focus now, no?
Yeah. And just looking back at the cross-border travel, what's the communication been like with travel agents who usually assist in this regional travel where people move across borders?
Well, as Abil mentioned earlier, the communication has been most important to be able to inform people. The only way you can have tourism is if you have tourists entering, whether it is by air, by land, by sea. So they need to know how can they get here, and the travel agents in the same fashion need to know how to advise their clients. So it's been an ongoing communication process through all of our outlets, whether it's digital or personal communication, obviously using a lot of the virtual platforms to communicate and let people know what is happening. Even over the last few months, with the changes at the airport, we've had to upgrade and continue to inform, and it includes also communication with the airlines. As you know, before there was a requirement to download the app, and the airlines would not let a passenger on the flight if they did not have their app downloaded. That has since changed. So it's been a constant evolution and a constant communication with all of our partners, and that is something that we continue to do for all points of entry.
Yes. Now, before we allow you all to leave, let's just talk about some of the indicators that you're seeing at this point in time. I think Bill mentioned it a bit earlier that when you look forward towards the end of the year, the winter travel, there are already very promising numbers coming out from some of the major destinations. Do you want to update us on that? Abil?
Yeah, sure. So what we are seeing so far is that, for instance, the summer travel, because this particular season, especially January to about March, the first quarter of the year, still saw some very low performances worldwide in terms of tourism because of the various shifts and changes in restrictions as the pandemic has evolved. We are seeing now that since the European region is now reopening back, since the US now seems to be also reopening back and having major liberal changes to their restrictions from the CDC, similarly with Canada, etc. We are seeing much more interest in travel globally. In fact, the airline industry is now looking at increasing significantly their cost to travel around the world. But that is a great indicator to show you that the demand is absolutely there, especially for the summertime, and which is a little bit different than what we're used to if you really look at it. I mean, the summertime going into like August, September, and even to the end of July usually has traditionally been the low season for the country and for the region. That seems to be a little bit, at least for this year, will be a little bit different because of there's so much pent-up demand that exists in our main markets. Moving over now to the winter time, that is where the usual demand is. And what we're seeing is that our airlift is continuing to be strengthened. We're getting new airlines into the country, and there's interest of others. And so all of these things are very positive indicators for an industry that was literally just shut down overnight. And I think that many countries now are trying their best to see, initial projections were saying that we won't recover until 2024, 2025 in some cases. Yeah. But many countries are now seeing the light that most likely 2022, maybe early 2023 will be the time period is shortening, so that there's great optimism in the tourism sector worldwide, and especially in this region. I must say that in the case of the Latin American and Caribbean region, this region is the one that is rebounding the best worldwide at this moment.
Why is that?
We are recovering about 6 points better than other areas, and the reason for it has to be with the source markets that we have that are being able to the Americans and in particular are able to travel a bit more now. But also it has to do with the reopening strategies of the different countries. Now we still have some countries that are not reopened, but there have been many other countries that have been much more liberal in their restrictions, and that has allowed for travel to really continue and be boosted in this particular region.
Yeah. Okay. And CEO, before we close, I just want to have you address clearly, we've been hearing from the medical community a very loud opposition to this reopening, and of course that call is geared towards government in general, but also to the Ministry of Health, and whether or not we're adequately prepared. From your standpoint, what do you say to the public about the necessity of this move and also the safety that is involved?
Thanks, Marlene. I really do want to encourage everybody to look at the positive side of this. I know that there is a lot of fear. I know that there is a lot of uncertainty. Nobody knows what will happen. All of the opinions that have come forward from all sides, not only the medical side, I know that is one, but there are so many opinions and so many people with different types of expertise that have come and brought their opinions forward. And we need to consider everything, and we need to try to move forward with all of the information that we have. We cannot remain closed. It's not the solution. I don't think that if we remain closed or do not open the borders to tourists, it's any guarantee that we would not have another wave or that we would not have a variant. Even in some of the best situations around the world, we've seen where some of the model situations, they do still have to face the reality of what COVID is. Nobody is saying that there's no guarantee. There's no guarantees going forward. So we need to just move ahead in the safest way that we know. And that's what we're doing. If we need to make a change, we will make a change. Constant monitoring is part of the process. Constant change is part of the process. And so we have to manage the risk. For Belize, it's important, as for all the reasons we've already mentioned. And I think that we're doing the right thing. And I would like to ask the public to consider all of the hard work of all of the agencies on the ground and all of the people who are involved here. We have to believe in our people, and we have to believe that we're doing the right thing. And we have to take personal responsibility as well to keep ourselves safe, and understand that whatever we face, we make the adjustments. So.
And just lastly, as we close, is there also a contingency plan in place in the event that there is an increase in the number of COVID-19 cases?
Well, that is something that we would be guided by the Ministry of Health and Wellness. And I think in last week, the minister did mention that if there was a spike or if there was a situation, that drastic measures would be taken in order to address it. So I feel comfortable that constant monitoring is required, and whatever steps need to be taken in order to address any situation that we face, those steps will be taken. The Ministry of Tourism, of course, will be guided by the Ministry of Health, and any decision that is made at the cabinet level, our minister as well will make those indications to us at the ministry. So we will implement. I mean, whatever is necessary, we will adjust.
All right. Thank you very much for joining us, CEO Abil and Javier, and best of luck. Stay safe.
Pleasure.
Thank you, Marlene. Thanks for having
Thank you.
us.
Take care.
We will take our next commercial break, and when we return, it's to discuss food packaging and the labeling campaign. Stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.